towards a conversation that is deeply relevant to every one of us. Healthcare is no longer just about treating illness. It is about designing systems that truly heal. So our next panel discussion is actually focusing on the same. So are you ready to introduce the panel? Yes. So the panel discussion topic will be the future of health leadership, building systems that heal people, not just patients. What an amazing topic. Now, ladies and gentlemen, moving forward, we have our moderator, Dr. Javed Hussain from United Kingdom, Clinical Director, NEODAP. He is a multi-award winning aesthetic physician and an internationally recognized key opinion leader, renowned for his expertise in treating patients with high prototypes, with over 18 years of clinical experience and advanced training in aesthetic medicine. Thank you so much, Dr. Javed, for joining. Well, ladies and gentlemen, it's time to introduce the panelists on the stage. We have our very first panelist, Adil Hashim Al Kindi from Oman, Head Department of Cardiac Surgery, Senior Consultant, Cardiothoracic Surgery, Sultan Qaboos University Hospital. The head of the Division of Cardiothoracic Surgery at Sultan Qaboos University Hospital, Oman, trained at McGill University Memorial, Sloan Kettering and Cleveland Clinic. He advanced cardiothoracic surgery, TAVI and ECMO at SQUH through multidisciplinary care. It's going to be very intense today, I guess. Up next, we have our panelist, Benjamin Pelz from Germany, neuropsychologist, Curamed. Please put your hands together for Mr. Benjamin. Grew up in Germany and moved to the US after receiving an athletics scholarship. He received both his bachelor's and master's degrees in psychology, as well as graduate degrees in positive psychology and neuropsychology. He is currently about to finish up his PhD. Mr. Pelz has written multiple publications and has been featured on the cover of Impact and in the Wall Street Journal. That's so good to see. Last but not the least, our next panel, Naomi Carrington-Hockman from USA. Transformation expert, international speaker, author, Carrington-Hockman Enterprises Incorporation. Naomi is a world-renowned transformation expert, international speaker, best-selling author and philanthropist, a decorated combat veteran with over 30 plus years of military and civilian leadership experience. She specializes in transforming presentation skills. We welcome you, Naomi. Well, ladies and gentlemen, how does the panel look like? Come on, everyone. Very distinguished panel sitting on the stage. I think it's going to be a very impact-driven panel discussion on the healthcare topic. Well, over to Dr. Javed Hussain for moderating the session.
Good morning, everyone. Can you hear me? Great. How is everyone? Very good. Today should be a very interesting panel discussion. We all come from a variety of backgrounds and variety of nations as well. And it'll be very interesting to see from a healthcare perspective how we see things moving forward. But just before we do, we'll try and introduce ourselves just briefly. We've had a brief introduction, just a little bit more about the work we do. We'll start with Naomi.
Good morning, everyone. After 30 years in the United States military as an officer, one of the things I've learned is that to improve any system, you need to have leadership and effective communication. I've been doing that across the globe for the last few years, and in the healthcare industry, it is no different. We need effective communicators in order to be that impact to change all our systems.
Great. And Benjamin?
Yes. Good morning. My name is Benjamin Pelz. I'm a former professional athlete who fell in love with psychology along the way. I planned multiple fields, neuropsychology, clinical psychology, positive psychology, which will be really relevant for today, as well as, which one is a miss? performance psychology, so coming from my background. So I'm really excited to be here and hopefully can share some of my knowledge today.
Fantastic. And Dr. Adil?
Yeah, good morning. I'm Adil Al Kindi. I'm a heart lung surgeon. I've been in this field for about 25 years now. And during this period, I looked into what we call the seamless boundaries between different departments and divisions in terms to bring the care of the patient into a holistic approach rather than a very focused organ-oriented. And we've been successful in multiple programs, including the ECMO and the TAVI, which brings me here today.
Great. And lastly, myself, briefly been introduced. I'm clinical director of Neoderm in the United Kingdom. I'm an aesthetic doctor. My background is in dermatology. I would say I practice aesthetic dermatology rather than pure aesthetics in itself. I'm also an international educator. I train other doctors and nurses and surgeons in aesthetic treatments as well. And I'm also quite heavily involved in governance, which is something we will talk about very shortly as well. I'm chair of the appraisal committee of the Independent Doctors Federation in the United Kingdom. I've also done a lot of research and publications on skin of color, especially relating to aesthetic medicine, which has been internationally recognized. So it gives me great pleasure to be here with this wonderful panel. And just before we move on to the main part of today's conversation and discussion, I'm going to get yourselves involved. And by that I mean I'm going to ask you a few questions, and if you can raise your arms, that would be really useful as well. So by a show of hands, how many of you have ever felt that a healthcare interaction treated your condition but didn't fully understand you as a person? Raise your arms. Got quite a few people. Second question. How many of you believe that the future of healthcare should focus more on prevention and long-term well-being rather than just treating illness? Raise your arms. Oh wow, a lot more. So that's really interesting because it really highlights exactly why this conversation we're about to have matters. Basically, there is a clear gap between what healthcare often delivers today and what we all feel we need from healthcare. Final question. How many of you feel our current healthcare systems are designed more to manage illness rather to maintain health? So another good show of hands. And it's very interesting again because you all come from different parts of the globe. And we all have healthcare systems within our own countries. And I'll give some of my own perspective, but I'm sure we're going to hear from our lovely panel their own perspective as well, what their experience has been in terms of healthcare and how we see fit to move forward. So we're here to ask the question or discuss about the future of health leadership, building systems that heal people, not just patients. We know that across the world, healthcare has traditionally been structured around episodes of care. So basically, making a diagnosis, treating, and then discharging, and then goodbye. But we know that human health is a lot more complex than just that. It's shaped by biology, psychology, emotion, identity, environment, as well as increasingly now, as we've discussed yesterday with AI, meaning technology. So as clinicians, we're basically in a state of transition where we now have an opportunity and a responsibility to rethink what good healthcare is actually about. So today we're going to explore about that. And without delay, I'm going to open up a question to the panel. The first question being, as I've mentioned, healthcare systems are traditionally designed around treating disease rather than supporting long-term well-being. If you could redesign one aspect in terms of a fundamental aspect of the system tomorrow, what would you change, and what is currently stopping that change from happening? We'll start with Naomi.
My background is in the US, and the one thing that I would change is I would make our healthcare system focused on prevention. I was able to successfully legislate in the state of Maryland, where I live, for calcium score testing to be paid for by insurance companies. Why did I start with calcium score testing? Because it is the #1 killer for African Americans in the state of Maryland. So if we know that there is a final disposition of that problem, why would we not legislate so that the medical community can actually address that problem? So we were successfully able to do what my role was to communicate to the legislation what the calcium score test does, how much it costs, how it affects people, and that human aspect. And that's where I came in. I was able to teach the ladies that were doing their testimonials of their story. And they were able to present to the legislation their stories and how that one simple test was able to save their lives, and they were present because of that one test. So that's how I would change, focus on prevention.
Fantastic. And now open to you, Benjamin.
Expanding on that, it's all about prevention. In psychology, we actually have a field for that. It's called positive psychology. It's the field of promoting well-being. And I have multiple degrees, but the one that's probably the most important is my positive psychology degree. That's the one I use the most. But as you know, I work as a clinical psychologist, so I don't make any money with it. I don't earn anything with it because it's hard to scale. And that's the one thing that I think is preventing it. For prevention and measuring prevention, we have to have patience. And in this world, and especially the healthcare industry, we mostly don't have the patience to wait for the outcomes. So I think the thing that is preventing it from happening, from laying the focus of prevention and promoting well-being instead of just taking away symptoms, is that we're lacking patience and we're living in a money-driven world. And that's very unfortunate. But at the same time, I don't have the solution for it, instead of just waiting for it. Because I like money, that's why I work as a clinical psychologist, so I understand why it's like the way it is, but yet at the same time, I would wish in a better world that we are more in preventive medicine and psychology as well as classical medicine as well.
Great. And Dr. Adil?
I agree with the panel that, the key is prevention, so I would not repeat that. But let's understand that prevention is not industry driven. It doesn't attract industries, so not much money is put on that. So government should take the lead in prevention. Now, let's move to the next stage when the disease is already there. Now, historically, medicine was a holistic approach, so the doctor or the physician would look at the patient from head to toe and then treat the patient. But and then, knowledge has increased, skill has become more focused, and then we moved from a holistic approach to a very technical approach. And that is, you get focused on a disease, on an organ, or even a disease in the organ. For instance, I'm a heart surgeon, There are 4 valves in the heart, but actually I'm only focused on 1 out of 4. So I become very technical. And my approach to the patient becomes very technical, is that I'm focused on the single problem there to try to fix it. Now, the way to go around it is not like we do get less specialized, because this would not be possible in this era with the knowledge and the technologies that we have, but rather is have a team approach to the care of the patient. So you have multiple people taking care of the patient, all super specialized, but you also have a very kind of less specialized person who is leading the team. And the idea is that he looks at the overall picture, makes sure that the patient is addressed beyond the disease, like a person, and then the psychological welfare of the person, the other organs. It's very natural that we all focus on our part, and what we may do is actually affecting on other parts of the body. So you have to have a boundaries kind of departmental thing. You have a team approach to the care of the patients when prevention is not at the stage of actually treating the patient.
Fantastic. I think we're all on the same page here. We're hearing that term prevention happening. We're speaking about it often, and the way I see it, the change, to put it succinctly, really, is we need to change from a reactive model to a proactive or prevention model. And this is the way forward, because when we create an environment where we are implementing a proactive or prevention model, we are intercepting or interjecting much more earlier. What is stopping us from doing this? And at least from a UK perspective, we incentivize, i.e. money based on treatment, in terms of short-term output rather than long-term outcome. And it's this structure that actually needs to change, where we need to incentivize prevention, long-term well-being, rather than just treatment and discharge. So that's probably the way forward that I see, because even in my own practice, when we have an intervention that is much earlier, we are able to deal with any issue that they may have much more earlier and create impact. Is my microphone? Can you hear me? Yeah. So create an impact, what we want to actually achieve. We are treating them earlier. There's low risk as well, and patients actually feel more in control of their health and therefore have a better outcome. So that's probably the way I see it as moving forward, but we are pretty much on the same page when it comes to prevention or a proper way of treatment. Coming on to the second question then to the panel. As intervention and innovation accelerates, whether through AI, regenerative medicine, aesthetic medicine even, and also psychology, and in our case neuropsychology, how do we ensure that the progress doesn't outpace ethics, and who should be responsible for drawing those? We'll start with Naomi.
I want to focus on who is responsible. I believe it's a shared responsibility. We need to ensure that we are empowering every level of the system. I thoroughly believe that everyone plays a role and everyone can be a leader in ensuring that you are communicating effectively when there's a problem. In a lot of hospital situations or clinical settings, you have this hierarchy of leadership where the doctors are put on a pedestal. You have nurses, administrators, all different types of people are part of the system. We need to empower everyone. I believe even the custodian can let someone know, like a doctor or even the hospital owner, that he or she is doing something that's endangering the lives of our patients. In the Army, we have a saying, don't confuse rank with authority. That's the same thing that applies here. What that really means is a private can tell a general officer that he or she is being a dumbass and make that correction on the spot. It doesn't matter that that general has all the rank and authority in the world. And that private, in that moment, is there to take the leadership role of ensuring patient safety and security.
Thank you very much for that. And now open to you, Benjamin.
I totally agree on the governing body that it has to be a combination of multiple facets. So I want to focus more on the ethics and the technology part. A couple of weeks ago I was in a panel in Germany, a national panel where our top AI guys, engineers and stuff like that, and the ethics program were talking together, and there was a huge gap. So the technology basically was way further ahead than the ethics were, and I think we have to be honest about it. Technology moves faster than ethics do, and I think on the panel we had we said that the technology is on step 50 and ethics were on step 21 maybe. So we have to be honest about it, that technology goes faster than ethics, and we don't have the solutions yet. And perhaps if we talk about the governing body, that we need to stop technology at this moment and slow it down a little bit to get the ethics to keep up, to pace up. And I think it was a fantastic discussion, but it was also terrifying finding that the ethics is so far behind. And those were the very best we have in Germany, and they didn't have the solution, so perhaps it's time to slow down a little bit.
Great. And Dr. Adil?
Yeah, I mean, AI use in the medical sector responsibility is a combined ethical kind of a responsibility. It starts with the individual and grows to the institution. Now, in order to have this regulated, I mean, it's going to be difficult. We'll have areas where, a breach happens. But like in research, I mean, this should be, regulated by a regulatory authority in all the medical institutions for any AI use in the institution itself, and looked into this. And I do realize there will be a lot of breaches at the beginning. And we're going to learn in terms of reflex that something happens and then we learn in retrospect. But it's an ongoing thing, and we don't know the magnitude of AI in the health sector yet, how much it's going to be.
Great. So I think we're, again, on very similar sort of thought processes when it comes to how innovation is moving. I mean, on my point and perspective, innovation without ethics is one of the biggest risks in modern healthcare. In fields like aesthetics, which I'm in, there's innovation which is moving very rapidly, but there's also commercial pressures that are going on. And it's really important that clinicians take responsibility of that, and the answer really is in shared accountability. Beyond that, there's also a very high need of strong internal governance. And this is something that I'm quite used to dealing with because I deal with governance day in, day out. And we provide frameworks for clinicians where basically clinicians themselves need to adhere to these frameworks in terms of what they should be doing. And we need to make sure that they are adhering exactly to that. So internal governance is a major thing that will uphold the ethics when it comes to how rapidly innovations is advancing. Third question to the panel. In an increasingly technology-driven healthcare landscape, what does it truly mean to heal a person and not just a patient? And how do we operationalize that at a scale without losing human touch? There's that word again, Dr. Byron. Human. We used it a lot yesterday, and I'll open that up to Naomi.
If we're going to implement any changes in the healthcare system, we must maintain a human in the loop. Many of you have heard recently that an AI technology company did war games, and they found out that 9 out of 10 times the AI would do mutual assured destruction, as in it would launch the nukes 9 out of 10 times. Currently, we have AI looking at radiologist scans, and we still need to maintain that human to be able to use familial history, other human factors as contributing data towards making a decision when they read those scans. If we're going to make a change, you must keep a human in the loop.
Thank you very much. And to you, Benjamin.
Yeah, adding on this, last year I was in Miami at a conference where there was innovatives across all industries, especially in psychology. And there was a colleague who had a model where you could pick your favorite celebrity and basically let it be your therapist. And I think there's such a big chance in that if we add it to an actual person, to an actual therapist, to an actual psychologist, and have it as an extra tool. But if it's just the AI doing the therapy, like who's governing that? That would be really, really terrifying. And so I totally agree with you. We need to have a human being in the room. We have to have a human being overseeing everything that's happening, especially with psychology, a field that is so complex, where just the AI model doesn't cover everything. So yeah, basically that, keeping the human in the room, and still being open to the AI, adding to it, but definitely, especially in my field, and I can't talk about all the other fields, but in my field, the human touch is still so much important, and yeah, keeping it like that.
Thank you very much. And Dr. Adil?
Yeah, I think again, I mean, we are looking at medicine at this era into technical and, technology-driven. I would like to share an experience we had in our own unit. I mean, historically, there was this concept that, after cardiac surgery, there has to be strict visitation regulation and also food and everything for the patients. Being a very, in our culture, it may not be a very favorable thing for the patient psychologically. At one point, I decided to run a study on our own patients, and that is to deregulate things that we had previously. So we followed an open visiting kind of regulation system where the family can visit at any time, and also they could bring them food provided it's what is recommended. And also other things that we used to restrict at the beginning, and we allowed it for the patient. What we concluded at the end in the study was a significant reduction in the hospital stay, significant reduction in the infections, which we thought initially that we were trying to prevent infections, and also significant reduction in the rate of readmissions later on. So this all proves that we concentrate too much on the technical or the medical part, and we forget the psychological well-being. And this is anonymous to what I used to see when I was working in the States, that at times you could find a dog visiting in the hospital because the morale of the patients were low and they were used to bring the dog in. Of course, in our culture that is not the case, but we used to restrict visiting a lot. And we did see in this study that, by allowing family members to be with the patient most of the time, while observing some infection control regulations, is actually very helpful to the patient to the immunity, to the well-being, and so it all reflected in everything else. So overall, I think we have to think outside the box, not only to concentrate too much on the pharmaceutical side or the technical surgical side, but rather look at the patient as a whole. Clearly demonstrated by the audience that they perceive that the people in the medical system, they're too much concentrated on treating the disease rather than the patient himself. And I think this is a good example.
Thank you very much for that, Dr. Adil. And yes, I think we can see that this humanness is coming through in everything we're actually saying. To me, healing a person isn't just about dealing with the physical side. There is that psychological, emotional, and deeply personal side to it. When it comes to aesthetic medicine, and yesterday I was talking about this and one of the other doctors here as well, Dr. Shona, you can have two patients that come to you with exactly the same problems, and yet they have different motivations, different reasons behind coming to you. And if you miss those things without seeing the person as a whole, holistically, as we've mentioned earlier on, you can make mistakes. You can also cause harm. And it's something really important to understand. And how we think about this is, well, how do we scale it up? Because it is an investment in time, meaningful consultations, education and transparency. A personal story of mine, in a previous life as it were, was a general practitioner in the UK, a GP we call it, a family doctor. And when I first started training, we had 20 minutes. It went down to 15, went down to 10, went down to 5. When it came to 3 minutes, I said, no, I can't do this, I can't live with this, because your first appointment, you're going to have time and you extend over that 3 minutes, because there's no way you can see a patient, treat them, understand them in just 3 minutes and type everything up. I understand AI has its uses, and it's not an AI bagging session here, but it is a tool to create that time that we can spend with the patient, to understand them, to get that humanness out, and utilize and treat the patient as a patient and not condition. And if we can isolate ourselves and scale it up this way, I think we will be all better healthcare leaders within our environment. And because ultimately, healing happens through understanding, trust, and responsible decision making. And those things can't be automated. Lastly, just to wrap up, what key message would you like the audience to take away as a takeaway message in just 2 or 3 sentences? Naomi.
So what does that integration of AI and healthcare look like? It looks like what my primary care physician did in a recent appointment. She used an AI bot to take and record her clinical notes so that our interaction, she looked at me eyeball to eyeball, and she maintained that human touch during our appointment. She did not let the technology be a barrier to our communications. I think there's a role for technology in the healthcare industry. However, we cannot forget there is a human component that must be integrated.
Thank you very much for that. And Benjamin.
Yeah, so there's so many high achievers in this room, and I want to give you something on a personal note. I just did a study about gratitude journaling and how impactful it is. It's like a little thing you can do, write 3 things down that you're grateful for the day. And we talked so much about AI and how fast-pacing this world is. And what I want to give to all of you is do the little things that matters, do things that are mindful, do things that invoke gratitude in you, and they have such an impact. So we talked so much about healthcare, we talked so much about how fast this world is, and slow down a little bit and do those things, and we're still human beings, and therefore do those things.
And Dr. Adil.
I personally believe that healthcare workers are the most overworked, underpaid, and underappreciated. So I think AI coming in the game, in taking care of some of the what we call scut work and make sure that this is done automatically or helping out, will certainly help this sector of workers to be happier and will certainly reflect into the patient care that they will provide.
Thank you very much. I have 3 sentences only. Good healthcare treats disease. Great healthcare preserves well-being. Let's all be great healthcare leaders. Thank you very much, ladies and gentlemen. It's been a really insightful discussion. Thank you for listening, and thank you to the panel.
Can we have any questions? If you have, we are opening the session for Q&A. If you have any questions, you can just ask to the respective panelist you want. Any questions? Okay, we have a question here. Can we please pass on the mic to the gentleman? Can you please rise, sir, so we can just capture you on the camera as well?
Hi, thank you for a very engaging panel. My name is Dr. Akash. I practice weight loss medicine in India. Actually, my question is for Mr. Benjamin. You said that positive psychology is the thing that you practice the most, and this is the first time I'm hearing about positive psychology. So I just wanted to ask if you could tell me a little bit more about that.
Okay, so positive psychology is a very basic idea. It stems from the time after the Second World War when psychology focused so much on symptoms and symptom reduction. Then in the early 2000s, Martin Seligman, a colleague from the US, said, human being is more than just reducing symptoms. So there was this whole idea that general psychology at this time was about what can we do that we don't have any pain, that we don't feel bad. And then Martin Seligman said, there is a difference between not feeling bad and feeling good. And that's the field he started to emphasize on. So positive psychology in a nutshell is all about feeling good, promoting well-being, and saying there's more to human life than just not feeling bad.
Thank you very much, Benjamin.
Any other question? Then, okay, we can take one more question at the back.
Hello, good morning, everybody. My name is Raquel, and I'm a fitness coach. So your subject is very close to what I do professionally. And my question comes, how people like in my field, because we are healers also, and we work in prevention, how can we work together with you guys that are in the field treating people, but as we can work together as in the prevention side, if is that possible in the future? And maybe all of you maybe can say something about it.
You want to take that? No? Yep. Just repeat the question one more time.
So I'm a fitness coach. So I work with people that want to lose weight, that want to have a better relationship with themselves, with their bodies. And I work a lot with diet, training, the psychological part, the mental part. So what have you been talking about? I work closely with people. My question is, how can professionals like me in my field can work together with professionals like you for helping, to help patients, to help people to prevent diseases or to heal diseases?
You're asking how people in your profession can deal with people like ourselves?
Not deal, work together, because we have the same goal. So we want to heal people. We want to help people to have a better lifestyle, to prevent many people maybe to make you overwork, because now these days we have a lot of people with a lot of diseases, with a lot of physical and mental issues, so you guys are overworked. So how can we work together in prevention? How professionals like me in wellness and fitness industry can work together with doctors and to prevent you from being overworked and to prevent people to actually have diseases?
I think Dr. Adil was mentioning this and touching on this earlier on about working in multidisciplinary teams where we can work together in a preventative model. And again, at early stages. So depending on where you are within the healthcare system itself, you can work together with prevention, with a number of specialized people within their specialties, and also sort of use an MDT approach, a multidisciplinary team approach, and actually have meetings there where you can make patient planning to actually have the greatest impact again.
Okay, thank you.
I can also add, from the US Veterans Administration perspective, I recently was able to connect a chiropractor and a traveling podiatrist to sign up to be in our preferred care, community care system, so that as a veteran, I'm able to request this holistic approach in my overall treatment. So from the US perspective, we partnered with the VA hospital system to be able to have these holistic, non-traditional remedies as part of our holistic care.
Thank you.
Thank you very much, Benjamin.
And I can add on it from a practical side. So the clinic I work at, we have sport therapists, so it is a part of our team. So I work closely together with guys like you, and it's all about communication and knowing your own limits. So I'm a psychologist, even though I have the sports background. You're the expert on sports, I'm the expert on the mind. So knowing your boundaries, but also collaborating, working together. And we had amazing experiences with it, because mind and body is obviously connected. And therefore, it's happening already, and it's possible, and that's all I have to say about it.
It's amazing to hear. Thank you.
Thank you so much. Well, now with this, we are concluding the panel discussion. Can we have resounding applause, ladies and gentlemen, for the panelists? That was a very thought-provoking session we had on the healthcare. And as we say, the greatest medicine is not found in prescriptions, but in compassion, systems, and leadership. Can I have all of you please join us one more time for a group picture? Well, ladies and gentlemen, our panelists will be here throughout, so you can definitely connect to them over networking. Well, ladies and gentlemen, this is the time for the most anticipated part, the segment of the day. Thank you so much. Panelists, I request all of you to please be seated.